Good evening, everyone. Today we'll be talking about what is PTSD. Then we will talk about the symptoms and diagnosis, and finally treatment. What is PTSD? PTSD is a disorder caused by the environment or exposure to a traumatic event. In a normal situation, the brain switches from survival mode into a state of restoration. However, in PTSD, the brain is in a constant state of emergency. Symptoms of PTSD are intrusive memories. They include flashbacks, nightmares, and reliving the event. Avoidance, not thinking or talking about the event, and avoiding places, activities, or people that remind you of the event. Negative changes in thinking or mood, negative thoughts about yourself, others, or the world, hopelessness about the future, and memory problems. Changes in physical and emotional reactions, easily startled or frightened, always on guard for danger, and overwhelming guilt or shame. To diagnose your PTSD, your doctor will most likely perform a physical exam to check for medical problems that may be causing your symptoms. Do a psychological exam that includes discussion of your signs and symptoms, that includes the event or events that led up to the traumatic event, and use the criteria in the Diagnostic and Statistical Manual of Mental Disorders published by the American Psychiatric Association. A diagnosis requires direct experience to the event, witnessed in person, the traumatic event happening to others, repeatedly exposed to graphic traumatic events, and those typically go for first responders. Treatment. The primary treatment of PTSD is psychotherapy, but can also be combined with medication. Combining those two treatments can help teach you skills to address your symptoms, helping you think better about yourself, others, and the world, learning ways to cope if symptoms arise again, and treating other problems such as depression or anxiety, and misuse of alcohol or drugs. So what we've learned, PTSD is the brain in a constant state of emergency. The symptoms of PTSD: intrusive thoughts, flashbacks, avoidance, not thinking or talking about the event, negative changes in thinking or mood, and changes in physical and emotional reactions. Your doctor will perform 3 tests, a physical exam to rule out any physical symptoms that may be causing, a psychological exam to talk about what led up to the event, and the use of the Diagnostic and Statistical Manual of Mental Disorders. Again, the primary treatment is psychotherapy, but can also include medication.